Now, here is where it's real important for you to understand that diagnostic testing, imaging, can be very misleading as far as the actual cause or reasons for back pain. Here's a study that showed up to 25% of people who have no back pain at all will show a herniated disc on imaging. And 60% of people who have no back pain at all will show degenerative changes in their spine. So you might be scratching your head going, well, what does that have to do with anything? Well, think about it. If 25% of the people out there who have absolutely no back pain and no symptoms have a herniated disc that shows up on imaging, what that means is if you do have back pain and a herniated disc shows up on imaging, maybe it's got nothing to do with your back pain. Because people can have a herniated disc and no pain, then who's to say that's the reason you have pain? The reason you have pain could be because of all those reasons we talked about in part 2, right? The muscle weakness, the asymmetries, the imbalances, a torsion, something else going on in the body. So now, because they see the herniation on imaging, they assume that must be what's causing your back pain. They'll go in and they'll surgically fix it. If that isn't what was causing your back pain, now you've had surgery, all the complications to deal with from that, the things that have changed your body surgically, the scar tissue, the swelling, the recovery, and you still have your back pain. And you might even have it feel worse because now you've had surgery on top of the original cause of your back pain, which has not been addressed and has not been found. So please don't just assume because something's found on imaging that that's the reason you have your pain. It may not be. Here's another study, and this is a really well done study. This one doctor at this Cleveland clinic ordered MRI for patients complaining of back pain or leg pain. 13% of the patients showed that the herniated discs worsened in 6 weeks, and 15% of them, the herniated discs improved or were resolved in the patients. The interesting part, there was no relationship between the pain and the images. Some of the patients who experienced pain after the discs improved or resolved, and others said they felt better even though the discs had worsened or the herniation had gotten larger on imaging. So there was no relationship between the pain and what actually happened with the herniated disc upon imaging. Again, it's so important to not have surgery based just on what shows up on imaging. So there's lots of studies here that show there's a lack of correlation between imaging results and low back pain. It's becoming very well known. The data just keeps coming and coming. Chronic low back pain is blamed on all kinds of degenerative changes. X-rays, CAT scans, MRIs consistently show the presence of bulging or herniated discs, subluxation, scoliosis, osteoarthritis, pinched nerves, etc. And this all appears unrelated to whether or not someone experiences chronic pain. So while imaging can be helpful, it should not be the end-all be-all that's counted on to decide on whether or not surgery is a good idea. Now, I'm not saying surgery should never happen. And remember, this is not meant to be medical advice. This is meant to provide information to you so you can make a more informed decision and know better questions to ask, or even questions to ask, period. The important thing to understand here is sometimes surgery is necessary. Sometimes if you have complete weakness and you're losing the ability to function, say you're dropping things and you can no longer even hold anything in your hands, you've lost grip strength because there's pressure on a disc in your neck, then surgery may be warranted so you don't lose the use of a hand. The same thing can happen with your foot. If you're tripping on your toes, if you're losing the ability to lift your toes up and land on your heel, because there's pressure on a nerve root, then you might need to run, not walk, to a neurosurgeon and make sure you get that disc taken care of because you're going to end up with permanent nerve damage and you'll end up needing a brace on your foot for the rest of your life. So that said, I'm not saying surgery should never happen. What I'm saying here is that we need to be very, very careful that when we're doing surgery, it's absolutely necessary, it's absolutely warranted, and it's not just because of what shows up on imaging. We need to make sure that there's other diagnostics being done. There's other research being done as to what could be the primary cause of that pain and that problem. So in the long run, this is an interesting thing. Patients who receive an MRI for their back fare no better with their back pain. It's not being seen. These imaging strategies for low back pain are not really being effective at helping people with their back pain. So I sometimes will tell a patient, well, there's really no reason to get an MRI unless you're really interested in having surgery. Let's figure out what's going on. Let's figure out what's the cause of this. If we can't figure it out and things don't get better, then getting an MRI might be a good idea. And obviously, if there's an issue, serious issue going on, getting an MRI quickly might be a good idea. But it's important to understand that it isn't always what shows up on the imaging that's causing the problem. That's the number one thing to take away from this.